Diane, you've talked a lot about the services that Force can offer patients and their families who have more questions. What's the website that patients can go to get more information?
It's www.facingourrisk.org.
Facingourrisk.org.
Yes.
And do you find that for patients that are coming to the website from all over the country, all over the world, how much geographical variation is there in the quality of genetic testing that patients are offered? And by that I mean not just the testing. Do you find that some blood work panels don't include all of these mutations, whereas is there a spectrum? This is a good test, this is a bad test, this is missing data.
There is a spectrum, and that's really why it's imperative that you see a genetic counselor, because they'll go through your family history with you and they'll determine which test is the best. Do you need the whole panel test? Do you only need certain parts of the test? You know, as I mentioned, in my family, we knew exactly which gene the mutation was carried on, and so I only needed to get that specific test. Whereas someone who's coming in with no known mutation, but they have all of these cancers in their family, you know, that genetic counselor will be able to tell them this, you know, maybe you need to get this whole panel test done.
And I'm sure that the website can help direct some of the questions that patients should be asking the genetic counselor. Dr.
I just want to
Secord?
jump in really quick, because Diane and I were talking about this earlier. You know, this landscape is changing, as we mentioned, and one of the things we were just talking about before we came on was the possibility that we can do this testing in the tumor at initial diagnosis, and that can really help us determine who needs genetic counseling and which tests to evaluate. So I just want our viewers to be aware that that's something that could be coming in the future.
Now, for somebody like Angelina Jolie, who lost her mother from an inherited cancer, obviously she's a female herself, and how important is it, if you are carrying this mutation, for the boys in the family to get tested? Do they often get neglected because we assume this is associated with female cancers? Do you find that that's a common issue, that the girls have been tested but the boys have not?
Yes, and unfortunately there are still physicians, we hear stories come through our people coming for support of doctors who said, oh, that's on your father's side, you don't need to worry about it. And you know, it's very frustrating. But yes, it's very important for men to look at their family history, and if they know especially if they know if there's a mutation in their family, to be tested, because they, you know, as we mentioned, are at increased risk for certain cancers for themselves, but it's also important for their family members to know. You know, as I said, my mutation came through my father, and so if he had chosen not to get tested, I mean, I still could have, but if he had chosen not to, I wouldn't have had that next generation of information for myself to know that I had this 50% chance of my mutation.
So I have two final questions before we wrap up the segment. We've talked about getting family members tested. How far out do we go? Is it all offspring? Is it siblings? Is it offspring, siblings, cousins? How far out to the extended family do we go? And then my final question to both of you, Dr. Secord and Diane, is why would somebody not get tested, assuming that there's no financial restrictions? Diane, the first question on what defines the family members that should be tested.
So we know that each family member of someone who has a positive mutation has a 50% chance of inheriting this risk. If someone tests negative, their offspring then would not be able to inherit that mutation. It does not skip a generation. So in our family, you know, the generation ahead of me, my father and all of his siblings, those who tested positive, all of their offspring are eligible to be tested. So for my situation, I have 3 children, and they all have a 50% chance of getting testing. So you can see how this is going to continue. If they all test negative, then we don't have to, that's the end of the line.
Okay, that's extremely helpful to know.
Yes, and if they test positive, then of course it would have to go to the next generation.
And final comments on your experience of talking to many patients who are considering testing or have gone through, other than the financial limitations, which will hopefully be few and far between, particularly if patients can access force and be guided by how they can get the financial support if paying for the tests is an issue. What are the other factors that prevent people from going the next step to get tested in your experience?
So I mentioned age. You know, some women are just not ready to be able to make that decision. And we talked about the laws that protect people. So really then it's just, some people just need that extra information and extra support to feel that they're ready to take that next step for testing.
And if I'm a 35-year-old woman and I come to you and say, I've got a 2-year-old, a 5-year-old and a 9-year-old, would I be able to get them tested that early, or is that not recommended?
It's not recommended. Really, we don't recommend testing, or the genetic counselors don't recommend testing until at least the age of 18.
So at least the person can process
exactly.
the risk and
And
benefit
even
themselves.
18 we feel is very young. I don't know how many families you speak to with young people, but that's a really young age to be able to still process all of that information for themselves.
Dr. Secord, we've heard about financial restrictions, about age restrictions, and obviously some patients are just not ready to learn of the information that they are at increased risk of cancers. Any other thoughts or comments on why people don't get testing, and whether you feel there's any way we can probably help nudge them towards taking the decision to get tested if they have a lot of hesitance and reluctance to do the test?
Right. Well, we're trying to get to the bottom of this. We have a study at Duke called the Genetic Preferences Study. We have a program where everyone with ovarian cancer, and following SGO guidelines, that women with epithelial ovarian cancer get genetic testing done. And even in our program that is really good, we have great counselors, not everybody that we refer goes. So through this study, we're trying to understand those barriers better. I think one of the other barriers that wasn't mentioned was fear. I think there's sometimes people have a real fear of knowing. And
which
also,
is why it's so important for patients to be given the right information, up-to-date information, accurate information, and going to sources like Diane with Force is going to give patients much more up-to-date, accurate information.
Right.
Thank you so much to my panel. It's been a fascinating, enlightening session on genetic testing, and it's very encouraging to hear that these tests are available for patients, that they're covered by insurance, that we have the appropriate support mechanisms for counselling, and it really can change the outcomes for many patients who test positive, to get the necessary screening, surveillance, and if necessary, preventative surgery. Thank you so much to Diane from Force, to Dr. Secord for all your experience, and Michelle for sharing your story, and Greg, it's been a pleasure to have you on the set. Thank you very much.